Welcome to ActionCue. ActionCue Clinical Intelligence is the only healthcare software that integrates risk and quality management with performance improvement to provide immediate answers on information critical to improving patient safety, quality of care, and to reducing healthcare organization costs. And this is how it works. Home is like the front page news for staff, with announcements that keep them informed, notifications of tasks they need to work on, and a real-time updated customizable carousel of data and graphs, which allows staff to track their progress. The announcements section is straightforward and easy to use. These can be internal announcements from a designated ActionCue administrator with information pertaining to the organization or hospital, or messages from Prista on new ActionCue features and updates. Now let's talk about the queue. It is from here that ActionCue derives its name. Those personal responsibilities, or queues, that need action. The queues section is populated with alerts for tasks that require attention, using the clean desk principle. Once you've completed your work, the notification is wiped, and the next action is queued. The Performance Trends Carousel is a customizable slideshow of graphs and charts. Adding or removing measures is easy. They allow users to monitor quality and performance campaigns they are working on with real-time information and insight. And that is the ActionCue homepage. What is the fast path to insight? The ActionCue Clinical Intelligence application integrates risk and quality management with performance improvement to provide immediate answers on information critical to improving patient safety and quality performance measures of healthcare organizations. With its simple and intuitive dashboard, ActionCue's red, yellow, and green icons alert users at all levels within the hospital which measures are meeting their benchmarks and which are not. When a category is shown as all green, all of its performance measures are meeting their benchmarks, and there's no need for further review. Yellow shows areas that need improvement. Measures with a critical score relative to their benchmarks, however, are red or are marked with a red dot. With a simple click, staff are able to easily investigate individual performance measures to identify issues needing management attention. Again, looking for those in red. One more click, and now the user has real-time data pertaining to this individual performance measure. With that pattern of performance, you would likely want to use the built-in performance improvement function to create an action plan and improve the outcomes. The green-colored PI button shows that an action plan has already been started, and a performance improvement team is working on this issue. It looks like they're making progress because the button is green. It's that simple. Within 2 clicks and a few seconds, we now have identified an underperforming aspect of clinical performance, can see all its detailed data over time, as well as in graphical form, comparing between aggregated corporate, facility, and even national benchmark data. We also see what the clinical staff who are closest to the issue are saying about its causes and corrections, and action steps are even flagged on the graph to track their effect. ActionCue connects performance measures with events, so the performance improvement team gets fast insight and comprehensive details to work on. That task completed, the user can now return to the dashboard to find another aspect of hospital performance to focus on. That is the ActionCue Fast Path to Insight.
I think ActionCue pays for itself here at this particular facility. I'll use an example, say our fall rate. Over the last 3 years, ActionCue has allowed us to trend what our fall rate is. And we've actually in the last 3 years decreased our fall rate by 50% each year. So it allows us to monitor those processes, to improve upon those processes, and to promote patient safety and make sure that we're monitoring the correct processes that do matter to our patients, that improve their safety and improve their outcome.